The greatest health challenge faced by children today is not a life-threatening illness such as cancer, nor a trauma such as amputation. It's actually childhood obesity. The World Health Organization has recently stated that 42 million children over the age of 5 are considered obese. Furthermore, today's generation of children is the first generation to have a life expectancy shorter than that of their parents. They are living throughout their lives with physical and emotional impacts that this disease can have. We are seeing higher rates of cancer, diabetes, hypertension, heart disease, low self-esteem, and low self-confidence. This is unacceptable and extremely preventable. Now, our government has tried to amend this issue by focusing on our school system. However, this has proven to be ineffective as these children are not within the school system 365 days a year, 24 hours a day, 7 days a week. Instead, our government needs to focus on the socioeconomic factors, as these have proven to have the largest impact on an individual's health. Furthermore, we can focus on making changes to an individual's social and living environment that make default choices healthier ones. This has proven to have the next greatest potential impact. Whereas clinical interventions have a limited impact, education and counseling have proven to have the smallest impact. Now, the government can implement change by changing our food environment, and this can be done through the pricing and taxation of food. In the past decade, healthier foods have become more expensive, whereas junk foods are becoming cheaper. In the past, we had an issue with tobacco and increased rates of asthma and lung cancer. In order to make amends for this issue, our government increased the prices of tobacco by implementing higher taxes on tobacco products. This can be done through the taxing of more calorie-dense options and may have the same effect. By increasing the cost of unhealthier foods and decreasing the cost of healthy foods, especially fruits and vegetables, we're promoting the consumption of lower calorie and wholesome choices. The CDC has stated that by increasing the prices of unhealthier food options by 10%, will decrease the average national consumption by 8,000 calories annually. Furthermore, our government currently subsidizes junk foods, which indirectly promotes the consumption of unhealthier foods. We can do this by exempting the sales tax and causing an increase in price and decrease in consumption of unhealthier options, as the healthier options will be less expensive and more available. Furthermore, another issue that comes to mind has been the urbanization of societies. As our society becomes more urbanized, we are seeing a decrease in the amount of recreation centers, parks, and an increase in density of fast food restaurants and convenience stores around communities. For the government to combat this issue, we must increase exposure and access to healthier options and opportunities for children to participate in physical activity. This can be done by subsidizing outside of school recreational sports, increasing the number of recreation centers in various communities, and building various parks in which children can participate in various sports and physical activity outside of school. Furthermore, another issue that comes to mind is zoning. If the government implements zoning restrictions, we can limit the density of fast food restaurants and convenience stores within an area. This may increase the opportunity for children to consume healthier food options, as the more calorie-dense options are not readily available to them, and they will be able to participate in more exercise and physical activity. These are the ways I feel that the government can implement change in terms of the issue in childhood obesity. I hope you took something from this presentation, and I greatly appreciate your time and understanding. Thank you. Goodbye.